Before we begin, let's clearly understand what this title means, because it may affect your strength, balance, and independence more than you realize. Main health problem: sarcopenia, also known as age-related muscle loss. After age 65, sarcopenia accelerates rapidly and leads to weak legs and arms, difficulty standing, walking, or climbing stairs. Higher fall risk, loss of independence, main promised solution: stopping one daily habit that is silently accelerating muscle breakdown and replacing it with a protective daily routine. Why is this critical? Because muscle loss is not just about weakness. It is one of the strongest predictors of disability, hospitalization, and early mortality in seniors. And the most dangerous part? Most people don't even realize this habit is harming them. If you are over 65 years old, here is a medical fact that may shock you. Adults over 65 lose up to 1% of muscle mass every year, even faster if certain habits are present. Those with this daily habit have a 9 times higher risk of severe muscle weakness within just a few years. And here's the frightening truth: you can lose muscle without pain, without warning, without realizing it, until one day, standing up becomes difficult. Ignore this, and muscle loss quietly steals your balance, your strength, your independence. But if you act now, you can slow, stop, and partially reverse muscle loss, even after 70. This information is based on decades of clinical research and real-world medical practice. Dr. Roger Fielding, a leading geriatric muscle researcher, has spent over 30 years studying sarcopenia and aging. His clinical studies include more than 10,000 adults aged 60 to 85 in hospital and outpatient geriatric clinics. Patients who corrected this habit showed measurable strength improvements within 8 to 12 weeks. Fall risk dropped by up to 35%. Muscle function improved even in adults over 75. This is not internet advice. This is evidence-based geriatric medicine. Let's understand what happens inside your body after 65. Muscle loss is not just getting older. Here's what actually happens. Muscle protein breakdown increases aging, reduces anabolic hormones like testosterone and growth hormone. Muscle repair slows dramatically. Inflammation accelerates. Chronic low-grade inflammation destroys muscle fibers, known as inflammaging, nerve-muscle connection, weakens muscles, lose communication with the brain. Strength drops, even if muscle size looks normal. And one daily habit makes all of this worse. This is the habit silently destroying muscle. Scientific danger. When you sit for long periods, muscle protein synthesis shuts down. Insulin resistance increases. Muscle fibers literally turn off. Even active seniors are vulnerable if they sit too long. Study data. A landmark study found adults over 65 who sit more than 8 hours per day have a 9 times higher risk of severe sarcopenia, regardless of exercise. Patient story. A 72-year-old man exercised 3 times per week but sat most of the day. Despite workouts, he lost leg strength and suffered a fall within 2 years. The problem wasn't exercise. It was what happened the other 22 hours of the day. Habit number 2, low daily protein intake. Scientific danger. Older muscles require more protein, not less. Without enough protein, muscle repair fails. Muscle breakdown dominates. Strength declines rapidly. Study data: adults over 65 eating below protein needs lost muscle 2 times faster. Habit number 3, skipping strength signals. Walking is excellent, but walking alone is not enough. Without resistance, muscle fibers shrink. Balance declines. Falls increase. The daily solution that protects muscle break: prolonged sitting, plus stimulate muscle daily, plus eat enough protein. This combination is powerful, even after 70. Solution 1. Interrupt sitting every 30 to 45 minutes. Scientific benefit: reactivates muscle protein synthesis, improves insulin sensitivity, prevents muscle shutdown. Study results: seniors who interrupted sitting reduced muscle loss by up to 40%. Action plan. Stand every 30 to 45 minutes. Walk for 2 to 3 minutes. Simple leg movements count. Solution 2. Adequate daily protein. Scientific benefit repairs muscle fibers, preserves strength, slows sarcopenia study. Data protein intake of 1.2 to 1.5 grams per kilogram per day improved muscle retention. Action plan. Protein at every meal. Eggs, fish, dairy, legumes. Doctor-approved protein supplements if needed. Solution 3. Simple resistance signals. Scientific benefit. Reawakens dormant muscle fibers. Improves nerve-muscle communication study results. Even light resistance 3 times per week improves strength by 25 to 50%. Action plan. Chair stands resistance bands. Wall push-ups 10 to 15 minutes daily. If you are over 60 and want to stay strong, please like this video. Subscribe for senior-focused, evidence-based health content. Comment your age and whether muscle weakness concerns you. This channel exists for longevity, strength, and independence. Muscle loss is not just about strength. It decides whether you live independently, whether you recover from illness, whether you remain confident in your body. The good news: muscle is one of the most responsive tissues, even in old age. Small daily actions create powerful results. Do not wait for weakness to announce itself. Subscribe, stay informed, and protect your strength, because your independence depends on it.